How long would you be willing to wait to do the surgery?
That has been a good point. You know, in the cooperative group SWOG trial, we did wait 2 to 3 cycles, which, so there's precedence for that, 2 to 3 cycles of therapy. So I think 3 cycles would probably be the most that you would wait. Neoadjuvant trials are challenging, all right, because we don't see the patients first.
Takes surgery buy-in.
It takes a lot of surgery buy-in here. But the enthusiasm, if we can't complete a neoadjuvant trial in a timely manner with immunotherapy, we'll never complete a neoadjuvant trial.
When you think about it, though, it is impressive that, remember, the first Nevo was approved just 3 years ago. In lung cancer. And so we've moved it from second line, or immunotherapy in general, from second line to first line. All these controversies now stage 3, and now have a plethora of trials going on in the adjuvant, neoadjuvant setting. So you know, that speaks to the collaboration between academia, industry, and the community to advance the non-small cell with this new paradigm of immunotherapy. I think it's wonderful.
If you would have told me this was going to be happening 5 years ago, I would have said there's absolutely no way that we would see
in this time span.
Yeah, in this time span, to see an improvement in survival in frontline for all patients in combination with chemotherapy,
right.
Post-radiation, and now some of the signals we're seeing in early stage. You know, I get excited about the perioperative and the adjuvant immunotherapy trials, and then that excitement often gets tempered about what we've learned so far for targeted therapies for specific genotype resected lung cancer. We've had a Chinese study last year showing no difference in adjuvant TKI versus chemotherapy in terms of overall survival, and that's a select genotype with a targeted therapy. But I hope things are different here. I mean, we're batting much higher rates than we ever were in terms of home runs. And it's an incredible new world.
I don't think I've ever been to an ASCO where we had so many positive trials.
But I do think, again, there are still lots of knowledge gaps in immunotherapy. Remember gap number 1, we're talking about performance status 0 to 1. Other patient groups deserve an opportunity to see these great drugs, and we need to do studies in that. Also, remember, not every patient can be operated on, and SBRT is another area to which I personally am interested in combining SBRT with immunotherapy, and we have an ongoing trial that is looking very promising. So I just want to remind people that all patients really should have an opportunity. These drugs, for the most part, are so well tolerated, and we have to think about the entire patient population. Remember, across the board, there's still many patients that unfortunately do not get treated, and that is a sad but real fact.